Hi guys, my name is Dr. Nick Moncrieff and I'm a cosmetic plastic surgeon at Hunter Plastic Surgery. This is my wife Amber Moncrieff, co-founder of Hunter Plastic Surgery, and today's YouTube live video session is going to be talking about tummy tucks and mummy makeovers.
So yeah, welcome, Dr. Moncrieff.
Yes.
You're now a YouTuber.
Oh yeah, wow.
Yeah, big steam, hey?
Yeah.
So look, what we're trying to do this afternoon, we're at work on a rainy old Sunday, but we did a Facebook Live the other night, and unfortunately someone anonymous reported it and Facebook took it down, which we find really hard to believe.
Yep.
Because what we try to do in these sort of sessions is provide lots of educational content.
Yep.
So this afternoon, what we're going to try and do is cover the same sort of ground that we did last week, including answering some of the questions that patients had asked us, and also questions that patients often ask us about tummy tucks. So our goal really is just to help provide some information so that whether you are looking at Dr. Moncrieff or you're looking at another plastic surgeon, you've got enough info to make an informed decision. So what are we going to cover this afternoon?
So firstly, we're going to cover how it's done. We're going to then look at recovery. We're going to look at some case studies. We're going to look at pricing, costs, payment plans, and we're going to go through some risks. And then we're going to answer some of your questions and have a little tour of the Vectra room so you can see how the breast imaging is done.
Yeah, so for those of you that are interested in combining a tummy tuck with breast surgery, hopefully that will be valuable information for you. So first of all, before we kick off, just by way of background, we talk about our practice being a 5-star practice.
Yep.
The first and most important part of that 5-star difference is that Dr. Moncrieff is a specialist plastic surgeon. Now, I won't sort of go on about this for too long, but most patients that come in here are very surprised to find out that the term cosmetic surgeon can in fact be used by anyone with a basic medical degree. So 6 years out of uni, bit of basic training, and there are those people doing things like tummy tucks and mummy makeovers without that training. So how many years for you, Dr. Moncrieff?
All up, it took 17 years. By the time I finished medical school, then another 11 years training to be, a specialist plastic surgeon. So it's a really long time, and it's a, almost a lifelong commitment to get to where I am.
Yeah, so I think, no matter who you're looking at least make sure that there is one specialist plastic surgeon and not just a cosmetic surgeon in the mix. So the way that you find that out is after their names. If they're being honest about it, it should be the title, the letters FRACS, and then in brackets, plastic surge.
Yeah.
So that is an actual plastic surgeon. Some will use the term plastic surgeon on their website or, describe it as plastic surgery, but it's really not. So just be very mindful of that. Unfortunately, we see a lot of women, including here in the Hunter Valley, near Newcastle or part of Newcastle, who see other surgeons, and it's only afterwards that they say, oh, I didn't realise there was a difference until there was a problem. So just be mindful of that. The second main difference of those 5-star differences is that Dr. Moncrieff only performs breast and body surgery. So do you do facelifts?
No.
Do you do skin cancers?
No.
No. Do you do eyelids?
No, unfortunately.
Neck lifts?
No.
No. So really, what are the operations that you do?
So I really do basically about 5-6 operations. So I do all breast surgery, so whether it be breast augmentation, breast lifts, breast reductions, or combination of thereof. And then I obviously do body surgery, so abdominoplasties, body lifts. I do thigh lifts as well in weight loss setting, and also arm reductions in a weight loss setting.
Yeah, so that's a very focused sort of thing. I should also point out that the focus of this one really is that tummy tucks and combining it with breast surgery, but the focus will be on tummy tucks. If you're really interested, there was a great video that we did on a Facebook Live on breast reductions and lifts. So we might actually save that down and put that on the YouTube page as well, just so about 6,000 people have watched that. So that's a lot of information there on that. All right. So in our clinic, why do women come in to see you for for tummy tucks?
The number one reason really is babies. Babies cause they're great when you get them, but they cause a lot of damage or changes to women's bodies, obviously during the pregnancy and then after. And but certainly, we see a lot of excess skin that's made from the enlarging abdomen. Obviously, the muscles can come apart with multiple pregnancies. So babies is the number one reason. The next reason I would say would be, age. As people age, their skin is not as good, and people put on weight, and it's often hard to shift that weight once they get to a particular age. And then weight loss. So weight loss as well is a very important reason why we do tummy tucks. There's often a lot of less skin after people lost weight, and that the skin just doesn't retract enough after weight loss. So usually a combination of all those three things means that people get skin irritation, they get folds of skin hanging down, and they can't get into the clothes they want, even though they might have lost the weight. So those three factors really in combination are the main reason why we do these surgeries.
Okay, so we know sort of who tends to have it.
Yeah.
How do you actually do it?
So I'm going to show you a series of screenshots from understand.com, which is on our website, which is basically an animation series that shows in quite a good detail, without being too gory, just how these surgeries are done. So the first one I'll show you is with the skin removed or elevated. So the skin will be up this end of the patient, and you can see there the muscles which have been sutured together. So the muscles that have come apart in the tummy tuck, we've now sutured them back, and with a scar down the bottom here.
So, so these are on our website. So if you're on the tummy tuck page, you get to see this. And what I like about these is being animated, because I can't stand the sight of blood. Lucky you can. But they're not too gory, but just nice and informational. All right, so we've tightened the tummy muscles. Then what have we done?
So then we pull the skin down. So that skin that was up here before has now been pulled down. We're going to excise all that skin off, and we're going to make a new hole for the belly button and close the wound.
All right, and then finally, what does it look like?
So all stitched up together with the sutures along the bottom. There's the suture around the belly button. Note that there'll be drains coming out of the groin. Our sutures are not sort of crisscross or back across the incision. It will be just a running suture, so you don't see any stitch marks.
Okay, and so then one of the main sort of differences, I guess, in what we call a Moncrieff magic tummy tuck is the liposuction.
Yep.
So what role does liposuction play? So
look, really in my practice, liposuction is absolutely essential to get the really great shape changes and recreating waist and, overall debulking sort of the lower back, the flank region, addressing the outer thigh, thigh mons, all those areas which go together to make the overall rosette look as good as it can. And look, to be honest, if you're not doing lots of liposuction, I just don't think you can get the results. So certainly in my hands, I find that liposuction is absolute key, because not only does it debulk and thin out the skin, but it also means the skin can be pulled down tight. So you're actually freeing up the skin in the upper abdomen and allows it to be pulled down tight. So, I must say my tummy tucks are really tight. My tummy tucks, are usually bent over afterwards, but it's this liposuction which helps create that loose skin that I can pull down.
So I guess that's a really important thing if you are looking at, asking a couple of surgeons questions about what your options are, really asking them about liposuction. So I do see on the forums, people sort of say, I was up and about the next day, I felt fine. And, didn't need drains and things like that. Or someone will say, I went to a surgeon. It was the same guy that did my weight loss surgery and I only paid $500 out of pocket.
Yeah.
What's the difference between that surgery and what you're doing?
So that is really looking at apples and then looking at oranges. It's not the same surgery. So, if you looked at what we do, there's lots of liposuction. There's lots of other overall, modifications and techniques they use to get that surgery. If it's just a weight loss surgery and doing a tummy tuck, they're just cutting off the excess skin. There's no undermining of the skin. There's no liposuction. Okay, that's the first thing. Secondly, people who just do a minimum amount of liposuction, I just don't feel that they can get the results because they can't debulk the skin and they can't free the skin up, as I said before. And if patients are walking, I think, upright sort of immediately after surgery, the skin's not tight enough. And if the skin's not tight enough, you just can't get the really good shape and the really good profile that you often see with people who spend more time on this.
Yeah, so I think, that's the thing. It just depends on your goals. If just removing that excess skin is the goal, well, then there's other places that offer that. If you're really looking at that resculpting and, getting back into bathers that look fantastic and all that sort of stuff, well, then
it's a bit more effort. It's just a bit more time. It's a bit more recovery. It's all of those things, but it just depends on what you want. As Amber says, if it's really about what you expect out of this surgery.
All right, so when you're combining it then with breast surgery as well, so as I said, there is a really good video. It's on our Facebook, but we'll also put it on YouTube on breast reductions and lifts. But when you are doing a breast reduction and lift, just in summary, what's happening in a
So that's the typical anchor scar that we see in the breast fold vertically through the center of the breast and around the nipple, and that's that traditional anchor scar. That's what we use. There was usually a drain that comes out. So that can be combined with the tummy tuck as part of the mummy makeover, or we can use it if we're using incision at the base of the breast for the breast augmentation. which I'm sure you're familiar with. So incision at the base of the breast, in the breast fold, make a pocket, usually under the muscle. The implant goes in, and then we stitch it back together.
And so again, these videos are on our website. So the important one to note about the breast augmentation one is that you always do an under the breast incision.
Always, yep.
No armpits, no through the nipples.
None of that. Always in the base.
And always a silicone implant.
Always silicone. They may change in their shape, whether it be round or anatomical or teardrop. But always through the base of the breast, and usually 95% of cases always under the muscle.
All right. And then just going back there, so one of the questions that we were asked to address is the mini versus the standard tummy tuck. So what would be the difference there?
So mini tummy tucks is, really useful in a select group of patients. So those patients that are fairly slender and slim, they've got mainly excess skin in the bottom half of the abdomen, so all below the belly button. And they might have a little bit of muscle separation, but not too drastic. And also where we're not really going to move the belly button. So if the belly button's high, for example.
So this would be not a mini.
No, because we're resighting the navel. We're making a new navel. So the thing about mini is you don't really resight the navel. You can pull it down, especially when the navel's high, or release it from the muscle. But the idea is that you're just removing a short amount of skin just below the navel. And this scar is not very long. It's usually only somewhere between 10 and 14 centimetres.
And we're going to show you a number of case studies in a minute, and we're going to show you a standard one versus a mini one on patients that often get confused. So that this usually happens, doesn't it, with slim women who just say, I've just got this bit of extra skin.
Yep.
And it really just depends where that extra skin and fat is.
Yeah.
And where your navel is to start with.
Exactly.
So we'll show that in a sec.
Yep.
But we'll just talk about just completing the part of how it's all done. What about recovery from a tummy tuck or a mummy makeover with you?
Yeah, so I obviously do it always in hospital. So patients inpatients, and they remain in hospital for somewhere between 3 and 7 days. If it's a mini tummy tuck, those patients usually would go home, somewhere between 2 and 3 days. A standard tummy tuck is usually somewhere about 5 days, and if you're having something else, then it might take you sort of 7 days as what 7 days. But the idea is people are nursed sort of with their hips flexed to take the tension off the wound. They've got drains coming out of them. They're in a garment and usually got a catheter in their bladder for the first couple of days.
And the reason I'm looking down, I'm just getting these sexy garments out.
Yes.
So what would this one be used for?
Yeah, so that's used for reduction and obviously on breast surgery. And then we've got another beautiful set of garments for the bottom half, the tummy tuck. And you can see they're sort of elasticated Spanx-like material. And they're going to give you support, comfort, and provide pressure so you don't accumulate fluid underneath.
So the irony, of course, is that most women are having a tummy tuck to stop wearing things like this.
Exactly. But they will be wearing it
for about
6 weeks. So,
about 6 weeks.
So garments are on for 6 weeks. And the idea is that as it does, women do feel supported. And often when that 6 week period is up, people go, I want to continue to wear my garments, which is fine, of course. But the idea is it just supports you and takes the pressure off the wounds and also takes the swelling out of it.
Yeah, so pretty important to wear. We know that it's not necessarily the most comfortable thing. That is why it is better to have surgery like this, particularly wearing this sort of garment in wintertime. The bra sort of surgical garment's not quite as annoying, but this one is a great wintertime thing, which is the reason that you've done 12 tummy tucks in the last month.
Yeah, so that must be a record for me. So, but, it is a busy time of year for this. And look, if you're thinking about it, you guys need to, book a consult with us so we can get you in and get you planned.
The other really important factor is physio. So a number of our patients sort of say, what can I do to get up and moving again a little bit faster?
Yep.
Obviously, we want you moving. That's, we minimise lots of risks when you're moving, DVTs and things like that. But seeing a physio both before the surgery to prepare for it and afterwards can be really valuable. A number of our patients have used a guy called Tom Russell. He's down at Katara, Next Gen Physio. But look, most physios would be able to help you through a process like this if you had a local one or one that you regularly went to. So that can help in the recovery.
Really good idea. It just helps you, train your core muscles beforehand because they're going to be sore afterwards. And we find them really useful. And women who've done that, I think, have probably a slightly easier recovery than those who don't.
All right, so this is the really exciting bit. This is sort of like the reveal on the block where we say, and this is what we had before and this is what we had afterwards. So first of all, we start with a case where, it might be someone that would come in and sort of say, oh, Dr. Moncrieff, I really want a mini tummy tuck.
Yeah, so this is a good one because it illustrates the point we were making before. So you can see in the preoperative photo, the photo here, here you can see all that excess skin, and you can see some muscle separation as well. But the excess skin is above the navel as well. So that patient is not going to be suitable for a mini tummy tuck. They're going to do better with a longer scar and where we've made a hole to bring the belly button out. So that is a full tummy tuck for the reasons we explained. We've also tightened the muscles, and you can see here core muscles are nice and tight and brought together where they're sort of out to the side in the pre-op photo.
And I mean, this lady was here only 4 months post-op.
Yep.
Those scars look pretty amazing.
Yeah. So, usually with the skin is a bit thin and it's just, really just taking the excess skin out, the scars do heal very well. And, by 12 to 18 months, you really have hard pressed to find those scars. I will note, though, this patient has had liposuction. So to get those shape changes we're talking about, even though you think they look very slim, we actually have lipo through the flanks and the sides.
Okay. Now she... I'll just show you the side angle because it is a good example of where that skin was sort of located as well. Isn't it?
So there's a bit of excess, above the navel. You can see she's got this barrel-shaped sort of abdomen from the muscles coming apart. But now she's taut, she's concave, which an abdomen should be like. And so we've addressed the laxity, we've fixed the navel, and we've fixed the muscles.
All right, and she did also get the bonus steak knives, didn't she? What else did she have?
So you can see, breasts were a little bit lax and empty, and we've gone on to do just a standard breast augmentation, as we've described, and with not too big, but just giving a bit more balance to the top half in concert with the bottom half.
So she had 390 cc's, which sort of filled that up pretty well. Should just note there, are mummy makeovers just for mums?
No, so it's a misnomer. Obviously, any woman that's got excess skin and excess skin or weight loss and wants to fix the breast at the same time can have it. So pregnancy is not a prerequisite for it, but it's just a misnomer. Yeah.
All right, so. Oh, we're getting someone very unusual there commenting, but we'll address that later on.
Yes.
So this is probably someone who, was a good candidate for a mini tummy tuck. Explain why.
You can see here where the navel is high on this pre-op photo. She's got a pouch of skin sort of in the bottom half of the belly, and there's not too much muscle separation. So we've just done a mini tummy tuck, just just before the hip to hip. We haven't changed the navel, its position. We've just pulled it down, and we've done some lipo through the sides.
So that the big difference there was that position of that navel and where the excess was at the time.
Exactly, and so you can see the navel is high and that pouch is low.
Excellent. All right, so the next kind of main category, mass weight loss patients.
Yes.
So tell us about this patient.
So this lady's a 34-year-old lady. You can see she's actually lost a lot of weight because there's lots of stretch marks and loose skin all through the abdomen, but mainly sort of below the abdomen. There's some above. But we've gone on to do lots of liposuction. We've made her a new navel because she's not suitable for a mini tummy tuck, and we've also done a thigh lift at the same time. And I think you will agree that it's a lot better shape, especially in the abdomen and in the thighs. And it's all done together, so she can recover from this at the one time.
All right. So the only thing about this is that with the Medicare item number changes late last year, unfortunately, you can no longer do a tummy tuck and thigh lift together.
Yes.
So
something to think about, and we often just stage these operations. So do the tummy tuck and breasts in one operation, and if there's thighs or arms to be done later down the track, and that's what we'll do usually about 6 months later.
All right, and so we're just looking at the other angle there because I just think that's so dramatic, isn't it?
Yeah, you can see how tight the core muscles are. You can actually see the shadow lines of where they are. Whereas before, you've got so much thick sort of fat around the navel and in the lower half of the abdomen. You can't do anything with that unless you liposuction heavily.
So I mean, this lady had lost 55 kilos. So she'd done all the right things, taken that weight off, but there's nothing you can do with that excess.
No.
So on average, with sort of mass weight loss patients, when you're doing a tummy tuck, how much are you taking off?
So in the tummy tuck alone, we're taking anywhere between 6 to 10 kilos, just depending on how much. Recently operated lady, we took 9.9 just from the abdomen alone, but it varies obviously depending on how much weight they've lost and how much skin there is. But, it really is a considerable amount, and that's why they often spend a bit of time in hospital recovering, because that's a lot of tissue to take out in a few hours.
So we'll talk about the costs and therefore how much time you spend in hospital in a sec. But all right, so it's sort of more of a mummy one, but this time with a reduction and a lift.
Yep, and you can see, you know, all this excess skin. There's a big sort of globular, quite distended abdomen. The breasts are low. So we've done a big tummy tuck combined with lots of liposuction and a breast lift. And just look how much better she looks. I think she's gone from a size maybe 14, 16 to a 10. She said, I never thought I could get into a 10. And I think
from the side, quite dramatic.
You can see here, you know, this big distended protruding belly. Now it's tight, it's concave, as I said. The breasts have been lifted off the abdomen. Now they're sitting on the chest. And the patient looks longer because of all these features. So, so that's the benefit of doing the mummy makeover, is that you can not only lengthen the torso from the breast lift, but also with the tummy tuck also makes it a bit more linear.
All right, so one of the, we actually had a number of ladies asking about having a tummy tuck after other surgeries, so other abdominal surgery, but also after C-sections. So this is a great example here, isn't it? So this is a lady.
So this is a 40-year-old lady. She's had, I think, 4 or 5 children, and she's had an emergency operation where you can see she's got this cut down the middle of her abdomen. She's got a divot there where she actually had to have a colostomy or like a bowel bag because of the emergent surgery. The navel's distorted, and it really, you know, upsets her, and she's quite her self-esteem has been reduced by this. Now we've done the tummy tuck. We've made a new navel, so it's a full tummy tuck, lots of liposuction. You can see how much better she's looking, post-operatively.
All right, and again, this was a lady that had other surgery as well. So
bonus steak knives,
bonus steak knives.
So she's had a breast lift, a small reduction. You can see getting the breast off the abdomen and back on the chest. Again, all slimming and providing that beautiful, nice structure to her chest and to her abdomen.
Excellent. Well, it's sort of a range there of different reasons why and different body types. So obviously, you can all see the cosmetic benefits, I think, and you can imagine the self-esteem benefits. What about some of the functional benefits?
Yeah, so this is really important. I think, we do get asked a lot about this. So obviously, what you see is easiest to perceive, but, the functional benefits are quite serious and significant. So we've found that being involved in a study Australia-wide looking at the health effects of tummy tucks on women, you can see here, it was in the American Journal of Plastic Surgery, and we've gone on to find that back pain and also incontinence, sort of leakage of urine, is being significantly improved by tightening the muscles, which we do in 99% of cases of the tummy tucks. So there are, other effects that women can benefit from having these surgeries, and they're not to be they're not to be sort of put to the side, because they do make people's lives easier when those symptoms are better.
So that journal article was actually published in the US Journal of Plastic Surgery. They're a sort of preeminent surgery journal. But it was actually involving you, so you were one of the co-authors, and our actual patients. So
we
contributed to that. So for those of you that aren't really familiar with muscle separation, this is one of the worst examples you've ever seen, isn't it?
This is a tall lady. She's almost 5'10". She's had 2 babies, but the babies were lying transversely across her upper abdomen, and they've really pushed those muscles apart, and they never went back to where they should be. There, and on the operation, they were 9 centimeters apart. Now that's a record for me, but you can see she's got this sort of almost pregnant-looking abdomen, and she assures me she's not. And she's gone on to have the tummy tuck surgery where we've put the muscles back together, and you can see now how much better she's looking, at an early stage post-op. And she's really converted her from here to here, and with all the health benefits, which she'll see now, which is lack of back pain and, and minimise the leakage of urine, which she says is pretty much daily.
So that is an early result. This lady was actually in last week, and she specifically said you can use these photos because I think these are so dramatic. And that will just get better and better. The swelling just goes down and down and out, and she'll actually even get flatter than that. But
much flatter.
The benefits in terms of the health benefits.
Yes, so and they're immediate. Often people say they wake up, they feel like their back pain's gone. They feel like they don't have to rush to the toilet. So those sort of just daily living activities that are improved, and perhaps people don't think about them when they come from these surgeries, but it's a great added benefit.
And so if you're not sure if you have muscle separation, so obviously that really obviously distended look. I remember one lady came in once and said, "Oh, your husband's such a lovely man." She walked into the consult and she said, "Oh, I'm so embarrassed to show you, I'm so fat." And you looked, even without her clothes coming off, and you said, "That's not fat. That is massive muscle separation and a hernia."
Yeah, exactly.
And so sometimes it will be like in that lady's case, so obvious.
Yep.
But for other ladies, if you lay down, sort of laying on your bed, try and do a crunch. And when you bend over, try and feel between your abdominal wall. So you're sort of trying to feel there. Now, I mean, I've had 3 kids, I've had twins, but I actually am lucky that my muscles came back pretty well. And so that, when you're pregnant, they stretch out like this, and then when they should be coming back. But sometimes you're seeing 3 centimeters, 4 centimeters, 5 centimeters, 6 centimeters or more.
Which is a big gap.
And that's, you're just not holding that core in. So that's the little test there if you want to test.
I think it's an easy one to do.
All right. So in terms of, we've obviously talked about the benefits.
Yep.
We've got to talk about the risks. All surgery has risks, and
that's right.
It's serious stuff.
Yeah, that's right. So, these operations are not to be considered lightly. Obviously the tummy tuck and the breast reduction together, you'll have, potentially have, wound healing issues, but really, the scars fade for both those surgeries, and the time to the 12 to 18 months comes, we have barely any evidence of having the surgery. But, in any operation, you can get DVTs and things like that. You can get infections, you can get bleeding. You might have some numbness on the abdomen. The abdomen might feel hard for a period of time, up to sort of 5-6 months. And then, obviously with the breasts, you can get numbness in the nipples, and you can get asymmetry and things like that. So we'll go through that in a lot more detail in the consult, where we get the time, one-on-one to expand on these things. And, risks obviously need to be, canvassed in any of these procedures. Not to say that, it's at the forefront of our mind when we're talking about this, but, it is serious, and you need to be aware that, things in maybe 1 to 2% of cases can go wrong.
And I think sometimes, the term like mummy makeovers or tummy tucks, rather than using the medical term abdominoplasty, etc., it sort of minimises it. But it is very serious. So, you don't want to be in the hands of an amateur or someone doing it for the very first time.
No.
All right. So the other big issue is around costs. Everyone always wants to know costs, understandably. And so one of the things that sort of makes our practice a little bit different is we actually have all of this on our website. So, a lot of places you have to go in for the consult to find out how much it is and things like that. We just don't believe in that. We think if you're going to invest your time and your money in having a consultation with us, it's important that you understand what the costs are. In saying that, particularly with tummy tucks, it can be a bit confusing, can't it? Thanks, Medicare.
Yeah.
So in summary, there are 2 rates that we put on our website. One is what we call the insured rate, and one is the uninsured rate. So the insured rate is for someone that has the right level of health cover. So not just health cover, but the right level that will cover the item numbers which we've put on the website. Now, the item numbers are Medicare item numbers. So they're Medicare rules that say Medicare deems this to be a medical procedure, and as such will give you a small rebate. So you're not really after that, because that's not that big. But what it does, if you have that right level of cover, that is the key to unlocking that cover, which then helps to pay for things like the hospital stay.
Yeah.
If you don't have that cover, so you don't meet the requirements for Medicare, and I'll talk about those in a second, or you just don't have the right level of insurance, or you don't have insurance, then it's the uninsured rate. So just, in summary, if you are insured, your total out-of-pocket, including the surgeon, the anaesthetist, your garments, your aftercare, the hospital, the whole thing, $13,000. More if your BMI is over 28 points. And the only reason that is, it's certainly not a judgment from our perspective on weight, because we all have our weight battles, but it's simply that the procedure takes longer and therefore requires more time in theatre, and therefore, the hourly rate of everyone, including the hospitals, goes up. For uninsured, it's $20,000. Now, the thing with the uninsured rate is that is based on an agreement that we have with the hospital, and that is for a 3-night stay. And again, you just got to be aware, if you are a larger patient, it may be more than a 3-night stay. You may, in fact, even need a night in ICU, and just to plan that and factor that into the equation. For mummy makeovers, so with the breast augmentation, it's from $25,000 and $26,000 if it's combined with the breast reduction or lift. And again, that just depends on your level of insurance. But just please try and compare apples with apples. I know there are some people that put on their website some fees, but what that actually is only the surgeon's fee. So then you've got to go and get the quote for an anaesthetist and a quote for the hospital, and is aftercare included or not. So we just make it really easy, and we just say this is what the total fee is on our website. In terms of the Medicare rules, so to unlock that private health cover, if you are eligible, basically it's not great for mums, is it?
No.
So a couple of years ago, the government changed the rules. They actually said that unless you can demonstrate that you are mass weight loss and you've lost 5 or more BMI points, and you've got excess skin, which is getting infections and irritations that can't be treated any other way, and it's getting in the way of daily life, then you are eligible. What that means is, and it's particularly poignant for someone like me who is a twin mum, and a lot of the twin mums I know, or multiple mums, have even bigger muscle separation. Unfortunately, muscle separation alone at this point is not covered. Yeah. So we've worked with the research that we talked about earlier to try and lobby the government, as has our industry bodies. That may change in the future, but right now there is no cover. Yeah. So unless you're mass weight loss, you're just not covered, unfortunately. So obviously it's a big commitment. We understand that it is a lot of money to invest. We sometimes say to people, well, you're willing to renovate your house, but you deserve to also be able to renovate your body, particularly if you've got those sorts of issues that are bothering you. Superannuation is one way. We can help you with that. There is some information on the website about that. So that really is for those patients that have no other access to money and you've got really significant health issues. Your superannuation can help. Obviously, there's other methods. So some people use home loan redraws. Some people use, personal loans from their bank. Others use medical finance companies. So there's a few around. There's TLC, so Total Lifestyle Credit. There's MAC Credit. We try to advise against putting it on your credit card because it's a lot of fees. We do let people pay up to 6 months in advance, so they can just pay over that 6 months and then make sure that their final payments made by the due date, which is 2 weeks before surgery. So there's a few different options. Again, the links on this YouTube live will have links to our website if you do need more information on that. All right. So in terms of next steps, if you are interested in finding out more, just be mindful that, we do have wait time. So at the moment to see Dr. Moncrieff, it's about a 4 to 6 week wait for the next consult. And then it takes, just depending on what you want, about another sort of 6 to 8 weeks sometimes to get surgery. So particularly for those large sort of mummy makeovers, obviously that's taking out 7 or 8 hours in an operating list, which is often a whole list. So at this time of the year, going into the second half of the year, everyone wants everything done by Christmas, don't they? Everyone wants to walk into Christmas Day and show that sister-in-law a thing or two.
Look at me.
So this gets to be our crazy time of the year. So just keep that in mind. If you want to have surgery before Christmas this year, then definitely come in and see us. And if you want more information on our website, obviously there's a lot of information. We put some links at the bottom of this. But also if you fill in the contact form and just join our mailing list. So that way you get other pieces of information, when our events are on and things like that. Also, women's forums for surgery, like Plastic Surgery Hub runs a great women's only forum. You have to just apply to join. That is a really good one for finding out a lot about the experience and some pretty raw experiences from patients, which I think is really important, isn't it? That
so people really know what they're up for.
It's not a walk in the park, this surgery, and sort of understanding that you're not going to like us for about 2 weeks after you've had it done, but you do turn a corner and the results speak for themselves. So that's how you can get lots of other info. But if you are, obviously, we've said this multiple times now, but surgery is really serious. If you're seeking a second opinion, make sure that at least one plastic surgeon is in that mix, not just a cosmetic surgeon, which is, anyone with a basic medical degree, or someone that, sometimes there are cosmetic surgeons out there that are dermatologists, or they're general surgeons, or they're gynecologists. You make up your own mind about whether they've got the right qualifications to help you with that surgery. All right, so just quickly, we'll go to a couple of questions and then we'll quickly show you the Vectra room. So the question always comes up, I'm on a weight loss journey. Should I come and see you now?
Yeah, good question. Said a lot. Really, you should be as close as you can get to your ideal weight before when coming in, because I want to make an assessment based on where you really need to be before the surgery. And if you're still 10 kilos heavier than you really should be, then we're going to make you wait until that 10 kilos off. But as far as making an assessment, I really want you to be, within a few kilos really of your ideal weight.
And certainly for tummy tucks, to meet the requirement, if you are eligible, you need to have your weight stable for 6 months.
Yeah.
You know, we don't want to be operating on people that just got to goal weight last week, and then, you know, there is always that risk of, you know, it's not actually the final weight. So up or down.
Yes.
So that's important. What happens to tattoos? Right.
This is a good one.
This is a good one. So this is one that we posted, or I posted a couple of months ago. Now, just think, where do you think that tattoo has gone?
Anyone know? So look, the tattoo has actually been removed. So because we cut off from the navel down and that way, and then the other way, and so the navel, the tattoo has actually been put in the bin. But yeah, so there's no tattoo there. But tattoos lower down along the hip line also get removed. And that's the same reason why we cut out appendix scars and you know, and Caesar scars and things. All those scars get removed.
Yeah, so there was a couple of women that were having the debate with me on Facebook about it, saying it was not the same lady, and I kept trying to explain, and I eventually had to take a screenshot of that animation that we showed earlier just to prove that skin has gone for good. So that's why the navel looks so different, because it's a brand new one.
Yes.
It's a freshie. All right. Is it worse than a C-section? Is a tummy tuck worse than a C-section?
Yeah, good question. We get asked a lot, you know, and a lot of women do compare it to their C-section, often saying it may be a little bit worse because the scar is a bit longer, and, you know, even though there is a similar sort of muscle work, instead of pulling apart in the Caesar, obviously we're stitching it back together. That's reflected in similar pain levels. But I guess from the liposuction, it does make people a little bit more sore, but, you know, fairly close.
And just one final question. So a number of women ask about having implants done. Are you going to do the lift and implants in one operation or in two?
So it tends to depend on what that they've come for. So if it's a weight loss patient, I tend to do the lift first and stage by 6 months, and then do the breast augmentation. Or if the nipple is actually at the bottommost part of the breast, the lowest point of the breast, I tend to find it's very hard to get the nipple to come up, even with a lift and the implant together. So again, they tend to do the lift first, and then 6 months later we do the augmentation.
Okay, and again, there is a link there to our website. So you wrote an article about that.
Yep.
There's a number of articles that sort of cover those hot topics, like the weight loss and when to see you and things like that as well. So we try to sort of answer people's questions as well as we can, because I think they're
tricky and you know, it's complex, and it's not, you know, one size fits all. So that information, I think, is a good resource for people.
All right, so just to sort of wind up, so what we're going to do now is go on a little tour of Hunter Plastic Surgery. So we will show you the Vectra room without trying to get, oh no, we are actually attached to that. So we'll just take that one out. So well, as you can see, this is Hunter Plastic Surgery. Oh, so the lights are a bit funny, but so we'll take you down now, and you can just see the room that we do the Vectras in. So it's actually the room that we take our, so here we are. So you even get to see, you know, this is like a room where we do our little post-op visits and things. But this room is where we do our Vectras. So what you're seeing there is the Vectra machine. So we also take all our photography in this room. So the Vectra machine, it's just low at the moment because it's not actually on. But the idea here, in fact, Dr. Moncrieff, would you like to demonstrate? Obviously, normally it would be a little bit higher.
And so the patient stands here, so we don't put people's breast in the machine. It's just a camera that spins around and takes a 360 sort of image, and then puts it together, and then shows you then onto this computer screen. It can provide a simulation of what your breast might look like with particular size implants.
So, I was just going to say the idea here. So in real life, so it's just our practice manager that does this. In real life, there aren't any stars over the nipples, but obviously we have to do this for the platform for YouTube. But this is a before. So this is what a real patient's enhancement could look like. So before and after, also before and after. And you get to play around with different sizes and different shapes. And a lot of people say, oh, my sister-in-law's had this size or whatever. And then you get to see what that would look like on your own body. It also works for reduction. So obviously this is normally on the computer screen, but just for the purposes here. And again, so, you know, that's one. So you're seeing the before there and then the after, and you're
lift.
seeing that lift with the scar, anchor scar underneath the breast, up the breast and around the nipple, and then again from the front view. And Dr. Moncrieff, you would generally say that in real life you get it even better.
Yeah, I think people, often are very, a bit wowed by the Vectra result, but when they see it in real life, they go, "Oh wow, it's even better," and we get that comment quite a lot.
Yeah, so the great thing about it is that you can come in and see Jess for the Vectra. It's only $50. And then if you want to proceed with then an actual consultation with Dr. Moncrieff, then that $50 comes off his fee. So it's just a good way of kind of trying before you buy, I guess. But the other great thing about it is that Jess has access to Dr. Moncrieff's diary. So if you are looking at wanting surgery a little bit sooner, then that's something that she can then fast track. So yeah, hopefully that's of value to you. And yeah, just remember we've got lots of links there. There's lots of information on our website, but please don't hesitate to reach out, either comment on this thing or on, you can send us an email or give us a call or on Facebook or Instagram or all the platforms we're on, and, ask any other questions. So hopefully that was helpful.